brushing my teeth one day and I noticed I had a lot of gum recession on this tooth right here, to quite an alarming degree. I saw a doctor who said I was brushing too hard, and he got me a gum graft, which he took from where my wisdom teeth used to be, and put it right there, and it was told to leave it alone.
What was the gum graft like? How sore was it?
Very painful. I also got a frenectomy, which is when they remove that little vertical flap of skin. Right, exactly. So that was a very long and quite a painful recovery, and I couldn't really, I could only have like smoothies, that kind of thing. And I was told not to look at it, to leave it alone, let it heal, and that the stitches would fall out. And when they did fall out, I was like, okay, I'll take a look at this. And I looked at it, and the gum graft was gone, and it was still this really deep gash, except now it was healing from the frenectomy. It was all swollen. It was but it was still all the way down to, you know, almost there. So I came in. I got the adjustment, the Occlusal Adjustment. Is that what it's called?
Yeah.
And I was told that, and it felt much better. My bite was different, and it, you know, took the pressure off that front tooth. And I waited, and I took a peek at it a while ago, and it's back to normal.
Most dentists out there, when they see recession, they think that maybe you brush too hard, or they have a different idea for the reason. So they'll take a piece of gum and sew it on there, and sometimes it doesn't take. So the bite is the #1 cause for that. So if you're hitting a tooth first, or you're hitting it unevenly, instead of teeth hitting in the center of each other, if they hit on the outside edge, or a front tooth if it's hitting first, that rocks it within the socket. So I picture like a mailbox with some loose dirt, and if you move that back and forth, the dirt washes away. So that's why you start to lose bone. So I saw his recession, and I thought, let's use the tech scan. So that's the computer that when you bite together, it tells you where you're hitting. And of course, sure enough, that was like one of the
33% of my bite force
Yeah.
was going to this one tooth on the front.
Yeah, and so I first made sure he was okay with me dusting off the edge of that tooth, so we adjusted it until it looked right, and then I was hoping to just see like maybe a little bit of gum came back, but then we look in there and like, holy cow, like it's even with the other teeth, like it looks perfect. Yeah. Gum come back after that is like usually unheard of, except for, you know, you take care of the bite, it takes care of everything. So at some point I don't think it's recoverable, but I think we caught it early, so wish we could have saved you the gum graft misery. But and then the next issue is the fact that he ate a little part of himself when he swallowed the gum graft. There's some cannibalism going on, so we'll deal with that later. So anyway, good job, buddy.
Thank you.